Is it possible that your back pain, your low libido, and even your anxiety are all connected by a group of muscles you've probably never given much thought to? Let's talk about your pelvic floor. Hi, I'm Dr. Camilla, host of the Intimacy Lab for Ubie Health. As one of the AI faces of Ubie's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to issues around pregnancy, parenting, and family planning. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Everything I share in today's video has been reviewed and approved by Ubie's medical team. Let's unpack the mystery of the pelvic floor. If you've never thought about these muscles before, you're not alone. They're hidden from view, hard to feel, and yet deeply tied to your digestion, urination, sexual pleasure, and postpartum health. And they're not just a women's issue. Here's what I hear in my sessions all the time. I don't know if mine is too loose or too tight, or if I'm even using the right muscles when I do Kegels. Sound familiar? The truth is, the pelvic floor is complex. It needs both strength and coordination. Too tight, and you might experience pain during sex, constipation, pelvic tension, or even erectile dysfunction. Too weak, and you could leak urine when you sneeze, feel pressure or heaviness in your pelvis, or struggle to orgasm altogether. A patient I'll call Maya came to me postpartum. She assumed the leaking she was having after childbirth was just her new normal. But when we dug deeper, we found she was overactivating her pelvic floor, clenching constantly without intentionally relaxing. With the right help from a pelvic floor physical therapist, she learned not just to strengthen, but to let go. Within a few weeks, her leaking stopped. That's a game changer. So how do you check in with your own pelvic floor? For those with vaginas, inserting a clean finger about 1 to 2 inches into the vaginal canal and gently squeezing can give you a sense of how well your muscles activate. You should feel a gentle lift and a full release. If you're tensing your abs or glutes, you're probably not engaging properly. For those with penises, the same muscles can be accessed via the perineum, the area between the scrotum and anus. Tenderness there or pain during ejaculation can point to pelvic floor tension. While self-assessment is trickier, it's not impossible, with the right guidance. One thing I want to clear up: Kegels aren't the answer for everyone. In fact, if your pelvic floor is already tight, Kegels could make things worse. Think of it like the gym. If all you're doing is contraction without stretch, you're setting yourself up for imbalance and injury. So what can you do at home? Start with deep diaphragmatic breathing. Yes, breath work. This naturally lengthens the pelvic floor. You can also explore yoga poses like child's pose and happy baby, both of which help release tension. For more targeted support, pelvic floor therapy is like having a personal trainer for this very private system. And yes, orgasms can help too. They stretch and contract the pelvic floor in waves, improving circulation and flexibility. Whether with a partner or solo, pleasure is not frivolous. It's functional medicine for your body. Worried about your own health? Start by checking in with the Ubie Symptom Checker at ubiehealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket, always 100% free. If today's episode helped you feel more empowered and informed, go ahead and like this video and subscribe to our channel for more doctor-approved info you can trust from Ubie Health. I'm Dr. Camilla, and remember, your body isn't broken. You just need the right tools to tune in.